sign up out here if you noticed when you got your name badge that for our picnic. It's coming up. Yeah.
So surprised it's soon.
I know. Just
Another, if you're happy and you know it, clap your hands.
So yeah, we don't even have a month yet. We have our picnic and same place, and it will be a fun time to be had by all. So be sure and come, put on your calendars. So our picnic in June, no in-service in July, and then our next one will be the 18th of August. So yeah, almost the end of the summer before we see you all again.
Will there be one in June?
We have the picnic instead. Yeah. Our guests today are from Active Home Health Hospice, and John is, and Dan, who's not here yet,
Traffic jam on the way, so.
are going to present on strokes. And so get your brains going to ask lots of great questions. And is Julie going
She'll
to?
be down here in just a minute, so if you want to say anything else.
Well, we can sing the whole song. Just, okay. Anyway, Julie Staples wanted to come down and just visit with you for just a minute, and then we'll turn the time over to John. Active actually is in Sandy, but they service, John, all of Utah County.
All of Utah County down to San Quinn, all of Salt Lake and up to North Ogden and out to Tooele, Eagle Mountain. So
Okay, huge area. Okay, Julie, come on down.
Oh, wow. It's okay. So before Gary passed away, he wrote a list of like 25 things I have to do. But they really, each one was like multiple things in it. So one of the things on his list is he wanted me to visit with everyone in Aspen and of course let them know how much he loves them, because he loves you and so grateful to you to help him provide for his family. And so I've delivered that part of the message. We're grateful for you and thankful that you all participated in his celebration of life. And that was so sweet for us to see how many loved him. Special, but okay. Now on to other stuff. I'm really good about compartmentalizing. If I can just focus on other things so I can function. But the other part of what he said is to reassure everyone that Aspen will continue as it has. We have very capable and amazing managers, and they do their wonderful areas like complete confidence in all of you that are managing. And I just want to relay that to you that we have no plans to sell. We are here for the long time. This is definitely Gary's legacy and his dream, and we want it to continue and flourish for years to come. And we're grateful for all of you, and just want you to know that's all I have to say. Matt, if you have any friends who are caregivers, we're dying from our caregivers. So any of you who consider that's like everybody I talk to, like everyone that came in to see Gary, from the hospice agency, I would always ask them, do you have any friends? Do you have any CNAs that might want a job? So, because we're doing great, but we could still hire lots more people. So, and then I know that Tori's worked out some bonuses and incentives if you can help us with that. Sure appreciate it. And my sweet daughter Maria, we're grateful for her, and it's just fun to have her aware of what's going on in Aspen, and she's been great in the scheduling until she took her vacation. We're gonna get back to work, so it was fun. Actually was able to write on everyone's check. That is on my cry. But Gary had a list of what he wanted in those checks. Sophie brought them. So they're from Bulgaria and me. So be aware. He has a list of a few more to go through too. So we'll probably go in the future. But it's pretty sweet. He meant so much to him. So that's all. I'll probably go cry for a few minutes. But I'm gonna run upstairs because I gotta work on some other things upstairs. But thank you and we're grateful.
Hey, Julie. Thanks, Julie.
All right.
Appreciate it.
Thank you.
We love you too.
Oh, thank you.
So without further ado, we will just turn it over to Julie.
Okay.
Now I'll start setting up.
Dan.
Sorry, I'm like, goodness,
You're just at the time you should.
that's right, apparently, traffic knew that, so.
I'm John, John Meekum. I work with Active Home Health. Yes, we are competitors technically, but just so you know, we don't have anybody. We do okay up in Salt Lake, but right up in, as it's hard to get caregivers, and we're not gonna take care of people unless we have good caregivers.
We have them in Montreal and so.
Yeah, we send our referrals down this way. Dan has been working with us for
6, 7 months now? No, it's almost, I think it's been 7 months now.
okay, so, but before that, he was a pharmacist for 10 years at CVS or Rite Aid. So
Right down the road from here, the one that was on 8 South back in the day, so.
So he knows it, he knows his stuff, but COVID kind of created
Yeah.
pharmaceutical hassle, a lot of regulation and a lot of process, and it just wasn't as fun as it used to be. And he was thinking, I need to have more fun. So he decided to come work with Active. We call him our brand manager.
Yes, indeed.
And he does a lot of in-services and education. He helps us understand a lot of things that's in there. So today's going to be talking about stroke and how that applies to caregiving and home health, hospice, and patient care. Also, in the back, I have a stack of pens and to-do lists. I know as caregivers, you guys have to-do lists all the time. You to-do a lot. So I will put these on the back table, take one or two or however many for your large to-do list.
He can always bring more too.
Yes, I might have backup in my bag if those all disappear. So I'll turn the time over to Dan now. Looks
Okay.
like you're up.
I'm up and ready to go. So yeah, like John said, my background is I'm a pharmacist, so don't really do much with drug therapy much anymore, but still a lot of disease states. So that's why John asked me to come so we can talk about stroke. Who has experience with strokes? Like if somebody asks you what a stroke is, what would you say?
Neurological disorder that affects the whole one side of your body or your memory or your speech or cognitive.
Really, there's not any sort of function that a stroke can't affect. We'll talk a little bit about how that works. So just to get started here, a couple of facts. So did you know that every year there's 750,000 strokes in the US? Right? That is a staggering fact. And not all those are deaths. That's just pure number of strokes per year.
Yep.
Patients older than 85, 17% of all those cases. So obviously, as you get older, your risk of stroke goes up. It's the 5th leading cause of death. We're going to talk about that. That actually is a good thing because it used to be a lot higher. So patients 75 and older have the highest probability of death after 5 years of a stroke. So even though they've had a stroke, they're still at risk for either a secondary stroke or just general decline from what that stroke did. And then stroke is one of the leading causes of disability. I believe it's in like the top 10. Only about 50% of people fully recover from stroke. So they have some form of disability, which as caregivers, you guys see and help with that a lot. So That right there, I think is one that probably doesn't come as any shock to people here in this room because of what it does. So going back to the first question, what is a stroke? So a stroke occurs anytime that there's a loss of blood flow to the brain. So this can happen in two different ways. It can happen less commonly where a blood vessel that goes up to the brain ruptures. That's called a hemorrhagic stroke. And basically they bleed. If you hear about bleeding on the brain, that's what this is. And obviously if the blood vessel has ruptured, blood can get to the specific area in the brain where it needs to go. More commonly though is this one right here. It's called an ischemic stroke, where a clot blocks one of the vessels. And that clot can happen in several different ways. It can originate in the heart, and then your heart sends it up, once it pumps out of the heart, it sends it up to the brain and causes that. It can happen where it forms in the brain. And it just got big and bigger. And then as it gets bigger, it finally blocks it, or it was in there and then it broke off and traveled to a smaller part of the brain where they had a smaller blood vessel. So this accounts for about 80% of all strokes. So it's much more common. Biggest cause of this is going to be like atherosclerosis, or also like AFib. You guys heard of atrial fibrillation, where the heart doesn't beat right, the blood pools in the heart and it stays there. As anytime blood stays in an area, you're at risk for a clot, because blood doesn't like to stay. It likes to flow. So why is that so important? Why is it important that the brain gets oxygen? So even though the brain only takes up about 2% of your body, it uses 20% of the oxygen your body needs. So anytime that you have that oxygen supply cut off, you start to get effects. It starts to have bad effects. So top 10 health achievements of the 20th century. If somebody were to ask you, like, what is the most important thing that we did as a country in the 20th century, what would you say? What would be some of the things that would come to mind? Antibiotics. That's a great one. What else?
Indoor plumbing.
I'm sure that would have made the list. I'm sure that would have. So yeah, so antibiotics on there. Motor safety vehicles, safer workplaces, getting fluoride in the water, family planning. But right here, declining deaths from coronary heart disease and stroke. So back in the 1930s, stroke was actually the third leading cause of death. So like I said earlier, fifth leading cause now. That's actually a great achievement. And that's happened through a couple of different things we'll talk about. One of them would be the treatment. You know, they've gotten really good at identifying and treating a stroke in like the ER. The treatments to either break the clots or to get in there and fix the rupture have gotten really good. They work really well. But one of the more important things, a reason why this has happened, is because of recognition. So BFAST is the acronym that we use. And these are all signs of stroke. And this actually hits home to me because before I left CVS, I had a technician who had, while we were working, she had these symptoms here. And she kind of hid it until the very end. But when she left, speech difficulty, she couldn't form a sentence. And I said, okay, go home. Her mom took her to the ER. They told her it wasn't a stroke. But then like a week later, she had the same symptoms. And I said, you know what? We're going back. Shut down the pharmacy. We took her to the ER. And there are other diseases that mimic these, and that's what hers was. But to see this and to know is very important, because if it had been a stroke, we needed to get her there as soon as possible. So the first thing for B is balance. So you ask, you notice, is the person experiencing any sort of loss of balance, headache, or dizziness? Because that can be a sign of low oxygen in the brain. Eyes. You ask them if they're having any sort of blurred vision. Face drooping. Ask them to smile. And if they'll smile, but as they're trying to hold that smile, you'll see one side of the face droop. That's a sign. That can be a sign of a stroke. Same with arm weakness. Ask them to raise their hands over the head and keep it there. And if they're having a stroke, one side will drift. And that's just because of the way the brain works. Speech difficulty, yes. You ask them to repeat a simple sentence. If they can't repeat it, that can be a sign. So anytime that they have any of these symptoms, that's what the T stands for. It's time to call 911. Don't hesitate, don't second guess, because if it is a stroke, time is critical. I'm going to give you a glimpse into pharmacy school. There's one phrase they told us that I never forgot, and that was like 12 years ago or so. When it comes to a stroke, time is brain. The more time you wait, the more brain tissue gets damaged and the more effects that have later on down the road. So if you have any hesitation, any doubts about any of these, call 911. Get them to the hospital, because you always want to err on the side of caution. Any questions, Swope? Any questions about
We should call
feedbacks?
911.
Yeah,
All right.
balance issue. Are you having a stroke?
See, balance issue, I would fail 100% of the time because I have terrible balance. So luckily there's more on there. So, all right. So consequences of a stroke. What happens when they have a stroke and they lose oxygenation to the brain? I like this picture here because depending on the area of the brain, you can never say, oh, you had a stroke, so you're going to have X, Y, Z side effects afterwards, because it all depends on what part of the brain. You could have a part of the brain that's responsible for motion. You could have a part of the brain that's responsible for talking. This is all electronic stuff, but talking, speech, same thing, vision, hearing. Depending on the area of the brain and the specific part, you're going to get different effects. For example, like if it's in the frontal lobe or the front part of the brain, that's the part that controls your personality, your reasoning, your speech and muscle movement. So having it here versus back here, you're going to see different effects. The parietal lobe or the top of it, that's where you control speech and sensation, like touch and pressure. Which so if when you touch something that's sharp, you pull away. After having a stroke there, you may touch it and they may not even know. And the occipital lobe, which is in the back, that's going to control your vision. And the temporal lobe, which is going to be the bottom part of the brain, that's the part that controls hearing, speech, and short-term memory. So depending on the area, different effects. So no two strokes are the same. Like we said, about 50% of stroke survivors experience some form of disability afterwards. We've all heard about right brain and left brain people, right? Well, just like if right brain people exhibit certain attributes, a stroke on the left side and the right side are going to exhibit different things. So on the left side, if you have a stroke on the left side, you're going to manifest physical symptoms on the right side. So if your right arm goes numb or your right arm loses function, because it happened on this side, just the way that those are innervated. You're also more likely to have speech and language problems. And I found this one fascinating. Your behavior changes to a more slow and cautious. Right side of the brain is going to control your left side. You're going to have more vision problems, and you're more likely to exhibit a more impulsive behavior. So behavior changes are very common depending on where it is. Yeah, that was fascinating to me. I never would have put those two together. In your guys' experience, what are some of the most common symptoms that you see people with a stroke have? Droopiness, so like the one-sided weakness. Anything else that comes to mind? And that's always the go-to, is that one-sided. Speech, absolutely. Sometimes they have trouble forming sentences. Sometimes they have trouble understanding sentences.
Hard to move.
Absolutely, especially because of that one-sidedness. So most common types of disabilities, pain. Up to 50% of patients who have stroke experience some form of pain. It can be in that one-sided or that limb where it happened. It can be muscle-related, so there's all sorts of different types of pain. The hemiparesis, or the one-sided weakness that we talked about, it's about 80% of patients. So that's definitely the most common symptom. You get increased fatigue in up to about 50% of patients. Dysphagia, or that's trouble swallowing. That happens in about 60 to 65% of patients. Pseudobulbar effect. Does that ring a bell to anybody? I mean, John knows because I've taught him that. Or it's also called emotional lability. Have you ever seen a stroke patient randomly start crying or randomly start laughing afterwards? It happens in about 20% of patients. And most people think, oh, it's just, you just got to get used to it. It's actually a physical defect from the stroke. It's not something, it's not like, pull up your bootstraps, you're going to be okay. It's just, that's the way it happens. That's because of the innervation and where the stroke occurs. That can happen. That actually happened to my aunt. She had a stroke earlier this year, and she was fine except for that emotional ability. She would randomly start laughing and crying and had no control over it. And you people who have that, they're like, what is wrong with me? And really, it's just a side effect of the stroke. Depression and anxiety, up to about 30% of patients. And that seems, I'm surprised it wasn't higher, because I can only imagine after having a stroke, what kind of, you have to readapt your whole world. And that's hard. Muscle spasticity, memory problems, aphasia, that's the impaired communication like we talked about earlier. All these are very common after a stroke. So, personal care after a stroke. You guys are the experts. What do you do for personal care after a stroke? What kind of things do your clients ask you to help with?
Showering, dressing, everything.
Everything, right? And that's because, personal care aides, you guys are often the first in line to help somebody because they don't need to get a doctor's appointment. They just need that extra little bit of help. It can happen at any point. It can happen right after. It can happen years after. There's no time frame for when you guys can get in there and help. Like you said, bathing, dressing, medication reminders, companionship, meal prep, running errands, driving to appointments, and so much more. Like there's really not anything that a patient can have with a stroke that you guys wouldn't be able to help with. But when do they need more help? When do they where does home health and hospice get involved here? So that's what we're going to kind of dive into here. So home health care after a stroke. What's the point of doing home health after a stroke? Yeah, regain function. It's rehab. It's the same thing that would happen if they were able to go to the doctor's office or the physical therapist. But with home health, they can come to their home if they're unable to go. So Medicare requires that they be considered homebound. A lot of times people think homebound means bedbound, but that's not the case. Homebound just means that it's very taxing and difficult to get them out of the house where they go. So the 3 months after, the first 3 months after a stroke, those are the most important months because the brain is learning to rewire itself. And you have to be proactive about it so that way the brain can make those new connections. And if it does, about 2/3 of people go through some sort of rehab after a stroke. It's very successful. So home health rehab decreases hospital readmissions, lowers overall cost of care, increases the likelihood that patient is going to stay independent in their home. What happens? Physical therapy comes. They focus on restoring functional activity, strength recovery, range of motion, balance and coordination. Kind of back to you're saying, getting back to be able to function, use their limbs the way that they always have been. You have speech therapy that comes in and helps with the loss of muscle tone in their throat, helps them learn how to speak again. Occupational therapy, they're going to come in and help them relearn those fine motor skills because they have to relearn how to do a lot of things, and they may even help them with some adaptive skills to perform those activities. If they're unable to do it the same way, they're going to help them learn a new way to do it, rewire the brain to do that. And then most importantly, you have the skilled nursing. The nurses are going to come in. They're going to help with medication management because after a stroke, I promise you, there's going to be a whole bunch of new medications, and they're hard to sometimes to tolerate. And having somebody in there who can see it right away and make those recommendations offered, the changes occur more quickly. Your side effects. Observation and assessment are going to come in and just monitor, make sure the functional and mental status are getting better. If not, again, quicker communication with the doctor is good to get things changed the way we want it to be. And then lastly, there's going to be disease education and training. We're going to teach them about what causes stroke, how they help prevent future strokes. Questions on home health? So you can see it's kind of a step up from personal care. You have to have, you work directly with the doctor has to sign off on it, but excuse me. I don't know any doctor that wouldn't sign off on trying to help the patient get better. Here, we're with personal care, we're focused more on just the cares. Home health, we're focused on a cure, getting them back where they were. Unfortunately, that doesn't always work, right? And that's where hospice comes into play. Most patients are going to see an initial improvement after their stroke. They're going to get better, but over time, they're going to decline. It's just a proven fact. Most patients will decline. Yeah, they'll lose function, cognition, quality of life over the span of several years. That's when hospice comes. What's the difference between hospice and home health? If we were to ask you that, what would you guys say?
I'd say hospice is end of life.
Exactly. Exactly. Hospice is end of life.
In fact, I once thought that a doctor had to be predicting a death before you could call hospice.
In a way, yes. So hospice is designed to be able to use over the last 6 months of life. So yes, they don't have to like they don't say, oh, so most people wait until they go to the doctor and they're like, I think you're gonna die the next week. Or heaven forbid, you're gonna die in the next couple of days. But it's designed over that 6 months of life, and there's certain guidelines. And with a stroke, they don't look at how big was your stroke, when did it occur, where did it occur. They look at quality of life. Are they having trouble eating? Are they having trouble maintaining weight? Are they having trouble swallowing? They had any sort of life-threatening illness or passion. If they say yes to those, they qualify. Now, so what happens if say 6 months pass and the patient hasn't died? Does that mean they can't use hospice anymore?
Good
No.
time, buddy.
Yeah, sorry, you outlived your care, right? But often people think that, but no, it's an estimate. Absolutely, 100%. So where home health, we're focused on a cure. Hospice, we're focused on symptom management. We're focused on comfort. So some of the things that we would be helping with, any sort of long-term consequence from that stroke. It could be the pain, be delirium as they start to have more mental problems, it could be respiratory distress, incontinence, constipation, skin and wound care. They're unable to move. What happens then? Bed sores, right? So it's helping to alleviate those or more importantly, prevent those. Seizures, anxiety, depression, all these things. And again, so much more, because with a stroke, there's no way to tell what exactly they're covering. Whatever happens with that.
And we absolutely love it when personal care is in there, when we have hospice as well, because the eyes and the ears help us to take care of the patient better and know when something's happening, when we can make an adjustment so quicker, and then they're more comfortable, and it just works so much better, both with home health and hospice with personal care involved as well.
Really, the more eyes and hands involved, the better. So now's your time. Questions? Fire away. What questions do you guys have on stroke care, anything like that?
Can a patient or a client may have those symptoms without having a stroke?
Oh yeah, absolutely. Yeah, those are kind of just broad, overreaching. So just because they have those doesn't mean
maybe not all of them. I don't know if she has.
And if those symptoms are becoming life controlling, life threatening, again, hospice is totally appropriate because it's based off of symptoms and comfort management. So, great question.
What can you do?
That's a great. So yes, there are lots of ways. The biggest thing to do is heart health. If you're eating your diet low on fats, low on salt, controlling your blood pressure, diabetes, I'd say those are probably the three biggest risk factors for a stroke. Diabetes, there's so much extra stuff in the blood. There's extra stuff in the blood. The blood's going to, again, not move as well. You start to get those clots. High blood pressure is probably the number one thing I think. Unfortunately, with high blood pressure, you don't always know you have high blood pressure. It's often one of those things that sneaks up on. And So keeping your blood pressure controlled helps us with your heart beats better. So anything you can do for heart health. Sometimes, depending on age and diseases, like say for instance, atrial fibrillation, depending on your risk, they put you on something like aspirin. But maybe aspirin isn't necessarily approved for everybody, but that can help prevent post-clot depending on the medical history. So.
I want a Panda Express. That's
There's nothing wrong with Panda Express, unless you may be eating it every day, then we might have problems. Absolutely.
Oh,
Great questions. Anything else?
So is it smart, just like, it's smart to just start taking it?
No, because a lot of times the risks will outweigh because take aspirin because it prevents clots, it makes it so you bleed a lot easier. So that's why you have to kind of balance the risks. So if you bleed easier, you get stomach bleeds, you get really stomach bleeds are the main thing that you worry about. Or if you get cut, you might not be able to get the stop. So really it's more you want to start on your own. If you've had a stroke or anything like that in the past, almost every time it has the benefits out there. Beforehand is something to talk about.
but if you have a heart problem, should you take aspirin?
Depends on the heart problem, but again, it would just be something to talk to the doctor about. Not all heart problems are created equal, but just though.
Is it common if someone's had a stroke to have another one?
Yes, unfortunately, yes. About 20% of patients have another one within. I can't remember the exact numbers. I want to say it's within 5 years. So yeah, it's actually unfortunately it's very common. So
Even if they're taking that?
even if you're taking the aspirin, sometimes it doesn't always work, but the aspirin will definitely help reduce that. But again, if you're over, like say somebody who's over the age of 75 or 80, they may not necessarily put them on aspirin because of the risk.
Usually the second one's even worse, right?
Yep.
What's the difference between a stroke and a heart attack?
Great question. So a stroke is when something happens in the brain to stop the blood flow there. A heart attack is when your heart stops beating.
Oh,
So you can have a lot of the same effects because if your heart stops beating, you're not getting the oxygen, but it basically is the root cause of it. So heart attack is here where something's happened. Oftentimes you can think of it where we talked about like that ischemic stroke where there's a clot. That's usually what happens, but it happens in the blood vessels in the heart.
oh,
So if the heart doesn't get blood, the heart stops beating.
mhm.
And so that's the main cause of a heart attack, whereas the stroke is going to be occurring here, and the effects would just be localized in the brain, which unfortunately then trickles down to just about everywhere else.
Okay.
Yes.
How possible is it that some of the different complications might show up later on when they might have not?
It's very possible. So yeah, like they may fully recover, and then just because depending on so many different factors, could be depending on how long they took to get them into the hospital, things like that. They're going to eventually see that deterioration. So they may see effects, 6 months or something or so down, or even later down the road, and they can link it back to that stroke. Yeah.
Question.
Yeah.
Having a stroke, does that lead to more pulmonary embolisms or at least a higher risk of that?
That is a good question. I do not know. I don't know if there's a direct link to that, but I will look into it and I'll have John.
It's the same kind of mechanism where it's a blood clot.
It's very
Okay.
similar, but so with pulmonary embolism, so with a stroke, the clot usually happens on the left side of the heart, or the pulmonary embolism, it usually happens in the veins and on the right side of the heart. And so they're usually different, where a stroke is more of a platelet-induced clot, where the pulmonary embolism is usually a venous-induced clot.
Okay.
So similar mechanisms, but I don't know if there's ever been a link to if you had one and it put you at risk for the other.
If you've got blood clots flowing through your body,
Yeah.
You don't want that.
Yeah.
you're at a higher.
So
I have a question about your friend that had some stroke-like
Yes.
symptoms. What ended up being the cause there?
great question. It actually ended up being migraines. She had migraines in just the right area where it was causing stroke-like symptoms rather than headaches. So
Okay,
they put her on migraine medication and symptoms got better.
Straight to your eyes.
Yeah,
so for home health reasons, that would even be a qualifier if that individual was homebound.
Mhm.
Because new medications
exactly.
that you would be watching and monitoring to be able to help that person overcome the symptoms of that situation.
Yep.
Okay.
And so one thing, I put on here our website, activehhh.com. We have for just about for the most common disease states, like for like death and that we see, we have blogs on there that will go over all this as well. So anything that we've talked about today, I got all this information from our home health blog for stroke, hospice blog for stroke, and our personal care blog for stroke. And so you can go on there for all sorts of different diseases, and you can read through. They're like 2 to 3 minute reads. They're very kind of skimming the top, getting that kind of basic information on there. So
Is Nurse Jane narrating that?
she's not narrating those yet, no. But so we do also, as you saw, I can bring that. John brings up. This is Nurse Jane. She's our flow of Active Home Health Hospice. So she's all over our website too. Like she's got videos explaining home health and hospice and personal care services.
Isn't there a time frame for when they're supposed to get to the hospital? Like within?
It's within like it's as fast as possible. I want to say like they recommend within like 4 to 6 hours. But yeah, as soon as you see the symptoms, it's straight to the hospital.
That first hour is critical.
Yes.
I had a couple comments I
Yes.
learned from my aging class. that I
Yeah.
just took. You can have balance issues from taking more than 5 medications at once, correct? Any age.
Absolutely,
Okay, so balance issues might be related to their medications. Or not. And I did a lot of research on stroke rehabilitation. I'm going into physical therapy. Yeah, the most critical time for improvement is 0 to 3 months. That's where you're going to see the most improvement. At about 6 months is where it starts to plateau. So you need to make sure you're doing your PT during those times. If you have a patient that has just barely coming home from having a stroke, do those PT exercises with them. It is critical. If you wait longer than a year, there's barely anything that you'll be able to see.
At that point, the brain's already made all the connections, and it's going to be slim to none chance of them making new connections. Great point.
And that 6 months is also a key to see, are you plateaued and staying, or are you declining?
Yep.
And is hospice appropriate at that time?
Yep.
Because if they're having that decline, get that help when they can qualify.
Okay, so I did make a little handout here. I've got one that's laminated, and then I've got kind of the Be Fast on here, kind of guide to home health and hospice services. And as part of the hospice, it's got on here the palliative performance scale. It's one of the questionnaires that they use basically to determine how functional they are. I just threw that on back just for your own reference. If there's not enough here, we can print out more and John can bring them by for you guys. So, okay,
Thank you.
of course.